Hi, my name is Deborah Campbell. I'm the founder of No K through 12 school-based health clinics in Oklahoma. I am a former litigating paralegal in special education law. I investigated non-compliant cases for the Office for Civil Rights in the U.S. Department of Education. Now, today I want to talk about school-based health care, the harm, and the elements for informed consent. This is our email address for our group. You're welcome to send us questions or to find out how you can volunteer and support our efforts. Before I move on to school-based healthcare, I want to do a review of the professional scope of public schools and what the proponents say. Now, in Oklahoma, school-based healthcare centers are unconstitutional based on the Oklahoma State Constitution. Our Constitution says the primary purpose is academics, and it goes on to talk about the responsibilities are delegated from the parents. The education statute, Title 210, Section E, again says the primary purpose is academics. But what I thought was interesting in Section E, it talks about students are made literate. If you put that in the context of national ranking of public schools, Oklahoma has always been at the bottom for decades. Is that because the schools are going outside their professional scope? I think it's a good question. Section F, the ultimate responsibility of children's education rests firmly upon the shoulders of their parents. Here's what the proponents have to say. However, there is no evidence-based research to support this. So what is school-based healthcare? It's promoted by the CDC, World Health Organization, the NEA, Planned Parenthood, and the LGBTQ organizations. That's a big red flag. It is student-focused socialized healthcare on school campuses or off campus. Now, when they say off campus, they're talking about they transport the child or they have a mobile unit arrive at the school. And it's modeled after the CDC's whole school, whole community, whole child. And it has an anti-parent agenda. I suggest every parent, concerned citizen, grandparents, you go to the CDC website, you read about this model, and then you look at the videos that they offer as teaching resources. They come in a variety of topics. I looked at some of them, and they're very concerning to me. Now, parental consent, this is what the parents they don't know about, is when you sign the consent form, you're giving authorization to the healthcare provider and to the staff to do medical tests, to diagnose your child, procedures, and treatment without you being there. Now, do parents go to their pediatrician, drop their kid off, say, hey, I'm going for a cup of coffee, I'll be back later to pick my kid up? No, you don't. And they wouldn't let you do it because it violates medical ethics. So why is it that these standards don't apply to the public schools? It creates intentional and unintentional Medicaid fraud and fraudulent IEPs. Now, school-based healthcare centers originated from school-based services for special education students, and then they began expanding it. Now, I'm not going to go into special education right now. I'd like to do a presentation in the future on this. But the key to this is before the expansion, the schools are not required to provide medical therapy and medical services to the children. Even the special ed children, they're not required to do that. Here are a few things that they provide, and it is the Trojan horse to gender affirming care. Now we're back to medical ethics. First, do no harm. Well, do you know if they're harming their kids or not? We don't know. Parents aren't there. So parents, you don't know if your kids are being harmed. Conflicts with medical ethics. Again, the physicians, they can't make decisions for a minor. They can't treat a minor without the parents being there. Then you've got privacy issues. Then you've got this power imbalance. Now, it also creates unhealthy children and overtreatment of children. And it's very important for people to learn about overtreatment of children. Here's one link, but there's a lot of links out there. And please keep in mind when you look at this stuff, these papers are written to support school-based healthcare. However, they're pointing out the problems that they've got to work out. Here's the backstory. So in 2004, the public schools were concerned, and the NEA told Congress the schools don't have enough money to pay for the services for the special ed children. And what they wanted Congress to do is to amend the federal law to allow Medicaid to create a school-based Medicaid program and for schools to be able to access the parents' private insurance to help with the expenses. Again, public schools are not responsible for medical health care and medical therapy of the children. So when Congress amended the federal law, there had to be state oversight given to an agency. So Oklahoma, they gave the school-based Medicaid oversight to Oklahoma Healthcare Authority. In that law, it says that OCHA is required to perform billing and IEP audits. Well, guess what? They've never done it. In fact, in July of 2024, I interviewed an employee and they said, oh, we don't audit the public schools. Well, that's interesting because OHCA is supposed to be making, keeping an eye on the money and verifying these IEPs. So to learn more about the purpose of an IEP, and I suggest you go and you look at what eligibility is for a child to be identified as special ed and to have an IEP. Go and look it up. An IEP under IDEA is defined as specially designed instruction. According to IDEA, schools are not required to provide medically necessary therapeutic services and medical services. Now, therapeutic services could be physical therapy, OT, speech language therapy, mental health, behavioral therapy. So those are some of the examples. Medical services could be your annual checkups. Since 2004, we have seen an inflation of IEPs. This raises the question in my head, how many IEPs are fraudulent? Again, there's never been any audits, no verification. So, and the reason this question comes to mind is when you look at school-based Medicaid, the enrollment process requires an IEP. But that doesn't mean that every child is eligible for an IEP. And that's why you need an audit. The statute requires OHCA to perform audits, like I said, and that would include IEPs in the billing. And I told you in 2024, I interviewed an employee at OHCA, and they said, no, we don't audit schools. However, that employee went on to tell me that over this summer, OHCA and the public schools were working together to expand school-based healthcare centers for non-disabled children in the low income bracket. Now, I don't know what they consider low income, but at some point they're just going to just open it up for everybody. But again, the point is now they're differentiating. You know, it's no longer for special ed kids. It's going to be for non-disabled. Let's talk a little bit about fraud. All right, so these are the things that came to mind when I was looking at this. So school-based Medicaid requires an IEP as part of the enrollment. Are these IEPs being verified for special education eligibility? Because the federal law has criteria. Each school year, does OHCA update their database of students that have IEPs? Well, talking to that employee, no, they haven't. And there has not been any audits again. Sustainability. So they need the buy-in from the teachers, the parents, and community, and they need funding. Now, community means the hospital, your local hospital, your local healthcare institutions, and doctors, and so forth. So the federally qualified healthcare center, they provide 3-year grants for schools that want to participate in this program. So once the 3-year grant expires, they have to have funding sources to continue. So they need state funding, they need financial support from academic partners, and from healthcare institutions. Also, sustainability is linked to billable patient visits, which ties to overtreatment of children and creating unhealthy children. So I suggest you look at some of these links and learn more. Now we are going to talk about informed consent. What are the elements? So in this context, it's legal ethics, medical treatment, and waiver of constitutional rights. You've got relevant facts, relevant risk, available alternatives. The decision is made with a complete understanding of the situation and allowing for a knowledgeable, voluntary, and uncoerced choice. So why can't we take these 5 elements and put them in the school's parental consent forms for all activities and for school-based healthcare? Now this, if you want to learn more about what happened in 2004 with Congress, amending IDEA, the Federal Register has public comments, and you can go and read those comments, and it's very interesting. At least I find it interesting. Pete Wright, he has an excellent website called Wright's Law. Great resource for parents who have children with special education needs. But anyway, he also wrote a document to Congress about his concerns about this amendment, the concerns that it was going to create fraud, and about fraudulent IEPs. To give you an update, in 2023 was the deadline for public comments. The U.S. Department of Education was proposing a rule to remove parental consent for children identified as special education. And I verified in July of 2024 that they're going through with this. So my conversation with someone from the U.S. Department of Education, they told me that the rules have not been completed yet. And with the government, there's a lot of other agencies involved, including the DOJ, and they have to go through a review process. So here's the problem. They're going to start with the special education students. And then what will occur is you have a bad precedent, and then they're going to go after the non-disabled students. So in other words, if they're not going to require parental consent for the special ed kids, then they're not going to require it for the non-disabled. So this has to be challenged in the courts. So if you're a parent that wants to take this so-called free socialized health care, you want your child to participate in it, proceed with caution. Because remember, when you sign that consent form, you were giving authorization for that physician and staff to make the decisions for the minor and to treat the minor. And if for any reason that you refuse treatment for your child, they can report you to social services and you could lose your child. And it is happening. And remember, schools are not required to provide medically necessary services. Now, the easiest thing to do, say no. Say no to K through 12 school-based health clinics. Tell the State Department of Education, tell the local school boards, the state school board, and your legislators, and say no, no more. Put a stop to it. And force the schools to go back to their professional scope of academics. Stay in your lane. That's all you have to do. And again, if you want to help us with our efforts and volunteer, or you have questions, please reach out to us at this email address. And I thank you for your time.